The vomiting is actually one of the symptoms which tells you first that the woman is pregnant. This vomiting sometimes may be very severe and sometimes may be very difficult to treat. Now, there are safer medicines available for vomiting which you can take safely. Okay. Usually, in the first 3 months of pregnancy, we do not give unnecessary medications, but that does not mean that medicines which have been proved safe should not be taken. If these medicines we have been using since about 30-40 years, there had been no problems because of these medicines, and so you really do not have to suffer with the vomiting. And there are different kinds of medicines. Certain kinds of medicines will work for certain kind of people. And to prevent vomiting, these vomiting tablets have to be taken very early in the morning. As soon as you get up from the bed, before even you brush your teeth, you take the tablet, have some biscuits or cereals to eat, and then lie down for about 10 to 15 minutes. After that, you get up and brush your teeth. The evening dose of the tablet you take around 5 or 6 o'clock, so that by 8 o'clock you should be able to have your dinner. If one medicine does not work, you can always ask for another group of medicine which will work. And the most important thing is, even if you have vomiting sensation, you should not stop eating. Many people say, I feel like vomiting, what is a big idea? If I eat, I am going to vomit. What is a big idea in eating? So, they do not eat. You should not do that. You should not be starving during pregnancy. Even if you vomit, it does not matter. If you take 10 mouthfuls, if you vomit 8 and then retain 2, that is fine. Okay, that will give you some nutrition. That is one point. The other point is, if we do not eat, the acid secretion from the stomach, the gastric juice becomes more, and if you eat, that gets neutralized. If you do not, this gastric acid, gastric juice will produce ulcers, and that makes things worse. So, even if you feel like vomiting, does not matter, have some tablets and have something to eat. In the first 3 months of pregnancy, you may not be able to follow strictly the diet chart because of the food fads. So, eat whatever you like, but even then do not take too much of sweets and fried items. Okay, these things should be avoided. You should take small quantities at frequent intervals. And there are a lot of other things for vomiting, like some dry fruits or say this alpaca fruit or dry grapes or this nartanga pickle or something. You can just have a bit of it in your mouth. Do not eat or swallow, just keep it. That will divert your attention, and maybe whatever you have taken, you will be able to retain at least for an hour or so. So, vomiting is very common, and there is one thing they say, there is a pressure point here in the hands, 3 fingers below the pressure point, between the ulna and the radius in the middle portion. If you just keep some pressure, the vomiting sensation may decrease. This is one of the acupressure points. You can try that, there is absolutely no harm in it. And many of these women do have increased acidity, they do have epigastric pain also. And because of the increased acidity, when the acid containing stomach contents come out, they have a little blood also in the vomiting. That is again nothing to worry, especially if you vomit after long starving, or if you are taking a little spicy things, you might vomit with a little blood. You can take medicines for that, and you can take some chilled water so that this bleeding will get arrested, and that is nothing to get worried or scared. But if the vomiting is not getting controlled with tablets, you can take injections. If it is not getting controlled with injections also, you have to have intravenous fluids, because severe dehydration can affect you. Okay, so when there is severe vomiting, dehydration can happen. You should get admitted and have IV fluids. Sometimes when it is very severe, we call it hyperemesis. Some of these women become really dehydrated, they don't pass urine for even 24 hours. If you don't pass urine for more than 12 hours itself, you should get admitted and have IV fluids. and you do not have to worry about this having IV fluids, it does not do any harm to your baby. Many of these women do have little bitterness in the mouth and increased salivation. The secretion of saliva will be too much. These women, like bitterness cannot be treated, you only have to divert your attention with some dry fruits in your mouth, and increased salivation also cannot be controlled with any medicines, you just have to put up with it. The other things that can happen is constipation. It is very common during pregnancy. First 3 months of pregnancy, constipation is common mainly because of decreased intake and dehydration. It can also happen because of the hormonal changes in the later months of pregnancy. The most important thing that you should know about constipation is you should not strain for stools. If you have constipation, there should be a change in the diet. Okay, you should take more of fibers. This session on diet will tell you what are the vegetables and fruits which contain more fibers. In spite of taking good amount of fibers, if you do not pass motion, again there are medications which are safe during pregnancy which can be taken to prevent constipation. These medicines, if necessary, can be taken throughout pregnancy. They do not do any harm. Most of the times we give isabgala husk where you mix it with water and take it. This does not get absorbed into the blood. It absorbs water in the intestines and then forms a bulk and then comes out easily. So, these medicines again, if necessary, can be taken throughout pregnancy as and when necessary. And there will be lot of flatulence also this way and lower down also, that is again nothing to worry. These are all harmless symptoms, these flatulence and all. So, you really do not have to take any medications. If necessary, again some medications are available which you can take. And another important aspect is indigestion. People simply do not digest whatever they take in the morning also. If they vomit in the night, they might vomit out everything. Digestion again gets slowed down because of the hormonal changes during pregnancy. There are digestive enzymes available, syrups and tablets which you can take to improve your digestion. But if you take in small quantities and easily digestible items, the problem may not be very severe. One more complaint regarding the gastrointestinal tract that can come is the piles and fissure. The piles and fissure are again mainly because of constipation. Because of constipation, the person strains and the piles and the fissure. Piles actually is a mass which will bleed during defecation, that is when you pass motion. Fissure is when the hard stools pass through the anus, it tears the tissues and makes a small abrasion, that is called fissure. Both again can be treated by mainly treating constipation. If there is no constipation, these two symptoms do not come. Apart from this, some local applications are available which can be used, and you can do what is called as a sitz bath. This sitz bath is nothing but sitting in a warm water. You take a plastic basin, the height of the basin should not be very high, take it as this much height, and fill it with warm water, add a little antiseptic solution, any antiseptic solution that is available, and then after passing motion, wash nicely and then sit in this water. What happens when there is a fissure or an abrasion? After, see, is because of the grooves, when you wash also, that place does not get cleaned very easily. When it is not very clean, the superficial abrasions, when contaminated with the motion, they becomes like an ulcer, and that produces reflex contraction of the anal muscle, anal sphincter, which aggravates constipation. So, what you should do after passing motion, then wash it, then sit in this hot water with an antiseptic solution, and then open the anus and close it repeatedly. That way the dirt in between the grooves will get cleared. Then wipe it with tissue paper and then apply ointments. There are ointments available which can be applied after passing motion, and there are some ointments which can be applied before passing motion, so that it will relax the sphincter and let the motion out easily. So, again for piles and fissure, surgery will not be done during pregnancy. It will be done only after delivery, at least a month after delivery, and not during pregnancy. If it is severe, it can definitely be treated by treating the constipation and by the sitz bath and the local applications that I told you. Headache is a common complaint again during pregnancy. In the early months of pregnancy, a mild nagging headache, especially people who are prone for it, they will have. A mild headache can be ignored, and you can put some external applications. If it is a little more disturbing that you are not able to do your routine work, you can take paracetamol tablets. Always check your BP if you have severe headache. If the BP is normal and if you have headache, you really do not have to worry. Headache, especially severe in the later months of pregnancy, if it is associated with swelling of the feet, face and high BP, it is a dangerous situation. You should report to your doctor immediately. In this case, the headache may be because of the high BP, which is called pregnancy induced hypertension. So, as I said earlier, many symptoms are normal, but once they are severe or associated with certain other conditions, then it becomes one of the dangerous things, dangerous signs. Okay, the headache as such is not dangerous, it is a sign of a dangerous condition. So, mild headache you can ignore. Whenever there is a headache, especially in the later months of pregnancy associated with swelling of feet and face, report to your doctor immediately. Now, let us go to the other symptoms that may occur again, which does not warrant treatment. Say for example, changes in the breast. Right from the beginning of pregnancy, the breast starts enlarging. That is it is getting prepared for breastfeeding. The areola, the black portion becomes a little more darker, and the tubercles like in that will become a little more prominent. The nipple also enlarges, and that is also becomes more prominent. And the breast may be very tender. Tender means it is painful. Okay, when you touch it, it is painful, and there may be a little watery secretion from the breast during pregnancy, which you can ignore. But if there is a milk secretion from the breast, that milk secretion should not come during pregnancy. It should come only after the birth of the child. If it comes before the birth of the child, you should inform your doctor. It can be an indication that everything is not okay with the baby. So, you have to get your baby's heartbeat, everything checked. If everything is fine and still there is secretion, just do not handle your breast, then you may be fine. Some of these medicines which are given for vomiting also can produce a milk secretion. So, again milk secretion, if it is present, you should inform your doctor. But you should not keep checking your breast every hour whether it is there or not. If there is a spontaneous secretion, you report to your doctor. If you keep handling the breast too often, that will also lead to milk secretion from the breast even before delivery.